This picture represents the inside of a colon at the ileocecal valve. This area right here is the ileocecal valve, and this is the tumor right here. And this is another example of the tumor as it kind of invades into the small intestine. This is before. This is during the process of the endoscopic mucosal resection, where we're injecting a substance to lift this from the bowel wall. It also provides for hemostasis, and it provides a tattoo localization, so we know when we go back to look at this site again if there's any reoccurrence. This is a particular instrument that we utilize to grab the polyp and pull it out of the colon. This is what the tissue looks like afterwards. These are cauterized edges of the polyp that's been removed off the ileocecal valve and the cecum. And this again is the tissue afterwards, and these are the tattoos that help localize the area so we know where to look the next time we go. And you can see we had a really good result removing this giant polyp. It started here and we ended here. This is the thinnest portion of the colon, and this is the most dangerous area to try to remove this type of polyp. The next polyp is just inside the anus. So here's the anus, and if we look inside the anus, it's hard to see here, but you can see the colonoscope. This colonoscope is bent 180 degrees to look down on itself. So when we started, we didn't get a real good picture, but there's a big polyp in here, okay? And then in the process of removing this polyp, this is afterwards, you can see that it's a really large polyp. And this is actually anoderm right here. And this polyp was right at the dentate line within the anal canal. And this was removed of a large polyp of the distal rectum. This particular procedure isn't done by all endoscopists. It's something that we've been doing in our office for the past 17 years and have had good success with. Endoscopic submucosal resection of a giant polyp.